Welcome to another Rant by Dutch Rojas. I got a couple of really good questions today, and I wanted to make sure we went over them. So I'm going to read them from my phone, and then we're going to talk to you. The first one, by the way, this person's really good. Thanks, Ed Swan. The capacity of the healthcare system is being stressed to its limits by battling COVID-19. Why haven't hospitals been able to scale to meet demands for critical care? Well, that's a really good question. It's a difficult question to answer, but here is the simple version of the complicated answer. Are you ready? It's a mix of lack of preparedness, a mix of state regulations and federal regulations. So we all know coronavirus is terrible. It is terrible, it is devastating, it's ruining the planet. What's making it worse is the fact that we have certificate of need laws in 35 states, including New York, that limit the number of facilities we're allowed to build. Literally, a physician entrepreneur, a nurse entrepreneur, any medical entrepreneur that says, I want to build a hospital, or I want to build a surgery center, or I want to build a radiology center, they have to ask permission from a special committee in New York State. Do you think that we could use more beds today? Absolutely. Do you think that's part of what makes it difficult? Sure. What's the other reason? Well, PPE. But see, in 2011, we passed this wonderful federal law that we passed because we tried to help people. But in the midst of trying to help people, we made it illegal for physicians to own hospitals. Well, what happened when we made it illegal for physicians to own hospitals? Well, we made it very difficult for physicians to operate in hospitals. Well, this morning, Eric Brickner had a wonderful video about the number of board seats that exist in hospitals. The amount of board seats that go to physicians and the amount of board seats that go to nurses. Well, as you can already surmise, it's a very small number. What happens when insurance people, private equity, bankers, along with hospital administrators that are generally lawyers, what happens when they're in a board meeting? Well, I can tell you the focus isn't patients. The focus is revenue. The focus is how much money can we raise by putting up pretty pictures and shooting pretty videos. See, this video isn't pretty, so I can say that. All right, so that's the answer to a basic question. We're making regulations and rules across the federal government and state government that make it very difficult for physicians and nurses to do the work that they've been called to do. Second question, what will happen with the backlog elective procedures? Well, we got 6 million of them backlogged today. 6 million patients. Can you imagine how many private practice physicians, nurse practitioners that have their own offices are going out of business? Can you just imagine? How will it play out? Wow, it's not looking good so far. And how can employers secure pricing for those procedures in a volatile market? Okay, we can get to that one. Let's say, for this question, what will happen with the backlog elective procedures? I can tell you this. The employers that we're talking to, global employers that are self-funded. Remember, self-funded employers are, generally speaking, about 70% of U.S. employers that have more than 100 employees. 70% of employers that have more than 100 employees are self-funded. Now, what are those employers going to do? They're going to create wonderful programs like the ones that we created so that patients and members of the health plan never have to go into a hospital. We've been talking to you for 10 or 15 years about why you should stay away from the hospital if you're healthy. Well, guess what? Now there's even more of a reason. We have 5,000 wonderful facilities owned by private practice physicians around the country and nurses. And those are going to be open for business. And if you're an employer or you're the leader of a health plan, you know where you ought to be sending your employees and the members of your health plan? To private practice, physician-owned centers. Now, we got a lot of pushback over the last 10 years. Dutch, you're going to send, we had a union say, you're going to send our people to a veterinarian, and how can they do it that cheap? And oh my gosh, blah, 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 blah. This pandemic, the unfortunate pandemic we're facing, is now giving people the truth about U.S. healthcare. And the fact of the matter is, we gave U.S. healthcare, the government gave it away to corporations. And corporations are doing their fiduciary obligation to their shareholders, and they are not taking care of you. You have to take care of you. You cannot give away your responsibility and defer it to someone else. If you want to have something done right, you have to manage it, and you have to take care of it. So how are employers going to solve this problem? They're going to solve it by making sure they have direct agreements with private practice doctors and facilities. And those private practice doctors and facilities are going to have to produce quality numbers, which they do today. Their quality numbers say we have infection rates and readmission rates of less than 1%, while hospitals and health systems enjoy a heartily readmission rate of 8% or higher and an infection rate of 3.15% or higher. These numbers are all verifiable by going to cdc.gov or nih.gov. They're very simple. The truth is in the numbers, but you have to know what to do with them once you get them. You have to know what to do with transparent prices once you get them. You have to know the people to talk to so that you can make sure your employees get into private practice, physician-owned facilities. So what are employers going to do? I think that's the answer. And I think we're going to take care of the 6 million. I think it's going to be 10 or 11 million patients that are going to be left behind because politicians, elected leaders, and business people don't understand what the term elective means. I think we're going to see a massive amount of people in big trouble not getting the care they needed. Why? Because, again, we allowed the wrong people to own the healthcare system.